I request President, KSS, Secretary and Treasurer, Dr. Devendra Hoshing, Dr. Mansingh Atnaik and Dr. Sagar Kurunker, along with the family member of the Prabhu family, Dr. Mahesh Prabhu sir is here, kindly chair this very important oration, that is KP Prabhu oration. We cannot thank today's celebrity, President ASI Dr. Probal Neogi sir, enough for his gracious presence and accepting our invitation to deliver Dr. KP Prabhu oration for the year 2024. It's sir's first visit to Kolhapur and it only reflects sir's untiring zeal to share knowledge to all nooks and corners of India. It is said that the accomplishments of the recipient lend a unique glitter to the Oration Award. It was a huge challenge to encapsulate sir's extraordinary achievements in a single-page citation. I hope I have lived up to this challenge. Kolhapur Surgical Society, on the occasion of the annual conference of Kolhapur Surgical Society, KSSCON 2024, takes immense pleasure in felicitating Honorable Dr. Probal Neogi, MS, FRCS Edinburgh, FRCS Glasgow, FACS USA, FAIS, with Dr. KP Prabhu Oration Award. The citation reads thus: the seedlings of Dr. Probal Neogi sir's success tree were sown in his early academic years when he passed MBBS from Armed Forces Medical College, Pune in 1987 and MS from MLN Medical College, Allahabad in 1993 with flying colors. The anchoring roots of Dr. Probal Neogi sir's success tree lie in his working with National Health Services, United Kingdom from 1996 to 2000 with special interest in surgical gastroenterology and minimal invasive surgery. During this period, he was awarded with FRCS Royal College of Surgeons of Edinburgh in 1997. Returning back to his hometown, he worked as a consultant surgeon, Regional Cancer Center, KNMH, Allahabad from 2000 to 2002. Since 2002, he is offering best of his services to his alma mater, MLN Medical College, Allahabad, where he started his career as assistant professor and later progressed to become professor of surgery in the same institution. The saplings of Sir's success tree plumuled when he started his organizational career as Secretary, Surgeons Club of Allahabad in 2004 to 5 and soon became the EC member of UP State Chapter in the year 2006 to 2008. Elected as Governing Council member of ASI for full 2 terms from 2016 to 18 and 2019 to 21, where he was also a national lead of a NSAP program in his second term. Sir was a member of Academic Council of ASI from 2020 to 2022. Considering his huge passion towards academics and organizational career, elected as a president, Uttar Pradesh, Uttarakhand State Chapter of ASI in the year 2022-3. No doubt, he was the best candidate to contest for the post of Vice President ASI 2023, President 2024. Thus, he was elected by a huge margin in the presidential election in the year 2022. And today we are blessed to have him amidst us as president of the second largest surgical association in the entire globe and largest in Asia Pacific, the Association of Surgeons of India. The branches of Sir's success tree are in the form of his significant role in establishing laparoscopic surgery in eastern UP by performing over 10,000 laparoscopic surgeries, numerous general surgical operations, including surgery on GI system, breast, thyroid, soft tissue, vascular, oncosurgery, all upper and lower GI endoscopy and basic therapeutic endoscopic procedures in last 25 years. Considering his magnitude of work, awarded knowledge of Dr. Probal Neogi sir's success tree are in his teaching abilities towards junior surgeons of common to advanced laparoscopic procedures in courses and workshops conducted all over India. Sir is an international advisor to RCPS Glasgow from 2023. He is the examiner for postgraduate and super specialty examinations in surgery for NBE. Examiner of the intercollegiate exams of the Royal Colleges of UK, UG and PG examiner for most of the major universities pan-India. regular faculty and examiner at scope classes, New Delhi, and PG master class at BHU, KHU, Lucknow. The glorious blossoms of Sir's success tree are in the form of delivering many orations at state and national level conferences, which includes Jaipal Singh Memorial Oration in KSSCON 2022, Presidential Oration of UP State Chapter in 23, T.S. Jairam Memorial Oration, KSSCON ASI in 2024, B.B. Mohri Memorial Oration of MP State Chapter in 2024, to name a few. Sir is a supervisor and reviewer of multiple research projects in his institution. The delicious and abundant fruits of Dr. Probal Neogi Sir's success tree are in the form of his organizational skills by organizing multiple live operating workshops, CMEs at Prayagraj and across UP. Active Rotarian of over 20 years and a Paul Harris Fellow of Rotary International. Having many passions outside surgery like traveling, reading, birding, but real passion being teaching and training postgraduates and young surgeons across the country. That sums up the height, the width, and the depth of this ever-growing, everlasting treasured doyen of the Association of Surgeons of India. As humble as we can be, on behalf of Kolhapur Surgical Society, a city chapter of ASI, we present to you, sir, the prestigious Dr. K.P. Prabhu Oration Award for the year 2024. Request Honorable Sir to kindly go ahead with this oration.
Thank you, Dr. Pratap Barule. It's my honor to present before you Dr. Kamlesh P. Babu Memorial Oration of the Kolhapur Surgical Society Chapter, City Branch of ASI. Dr. K.P. Prabhu was born in Honavar in 1924 to a poor primary school teacher and astute housewife. He was the son of a landlord, a true surgeon and leader, a brilliant student in his school days. He graduated from GS SET and KEM hospitals, being gold medalist there. In 1959, he was appointed as the honorary surgeon to the CPR hospital, and in this noble institution, he served the poorest of the poor selflessly. He was a teacher par excellence and was the founder president of the Surgeons Club of Kolhapur. His legacy is the Surgical Society of Kolhapur, and the state-of-art neurosurgery facility at WINS Kolhapur will remain etched in our memories forever. It's my honor and privilege to deliver the Dr. Kamlesh P. Prabhu Memorial Oration. I am going to talk to you about the declining physical examination skills among surgeons today. The reasons for that has been a shift in technology. The technology is moving very fast. We don't have time. And most importantly, I feel, is that the uncertainty that stems from the lack of confidence in most of us doing clinical examination. So my thoughts today will be on the gasping clinical examination, or the last pulse of the clinical examination. Of course, we teach our students every day through ward rounds, through tutorials, and then faculty stands by to assess the required maneuvers every day, day in, day out. And how did it come from? The art of passing knowledge to the next generation came from Halsted, who came to Johns Hopkins as the first chief of surgery and observed William Osler's approach in 1904. And he proposed the Halstedian model in a landmark lecture in Yale on the training of surgeons, whereby trainees receive increasing responsibility every year, as we all know, with advancing years. This involves intense and repetitive opportunities to take care of patients under the supervision of a skilled surgical teacher. The residents would acquire an understanding of the scientific basis of disease. The Halstedian model framed surgical teaching in our country, and it's still being followed today. But all that training can actually be undone the moment the student realizes that there are easier, faster, and unfortunately lazier methods of ordering tests and getting the diagnosis. And the engine for all that, the place where the dialogue takes place today, is the computer. The consequence of losing faith and skill is that we miss simple things. And we order tests, and we order more tests, and finally being a threat to patient safety. Apart from that, it's a huge financial burden to third world countries or low middle income countries like ours, and for Western countries, waste of man-hours. This patient, the 22-year-old girl, came to my OPD with complaints of fever for a couple of months. There were other non-specific complaints of body ache, malaise, and loss of appetite. She's been to a few super specialists and seen my other doctors on many occasions. She had a few tests done. She was being investigated on the lines of pyrexia of unknown origin. But nobody had examined her. Nobody had even removed her scarf, as is the custom in our country, in those parts in North India. Nobody had even removed her scarf. And once you remove the scarf, this is what you see. Discrete, rubbery nodes in the neck. The diagnosis is very clear. And in another case, this 40-year-old man came with history of nervousness, vague symptoms, being treated as a psychiatrist patient, went to the psychiatric OPD, anxiety, nervousness. Nobody had seen what was behind that beard. Take the beard off, and that is what it was, a toxic nodule of the thyroid. Ladies and gentlemen, these are not unusual stories. This happens day in and day out at our practice. I am not opposed to new technology. I teach in a tertiary care medical center in a progressive country with a cutting-edge technology. But I would like to make a case here. If the history and physical examination are linked properly to physicians' reasoning capabilities, laboratory tests would be just a measure or functionally or just to confirm the diagnosis. Physical examination can actually be the weak link, and if it's performed in a very superficial manner. Understanding the pathophysiological mechanism of a physical abnormality is essential for correct diagnosis. I would like to introduce you to this gentleman. Having trained in Scotland, I am particularly fond of him. He is Sir Arthur Conan Doyle. Many of you might know that he was a doctor himself And he was the creator of this fictional character, the great detective Sherlock Holmes. And the character of Sherlock Holmes, the detective, was based on his medical teacher, Sir Joseph Bell. Bell was an extraordinary teacher with an eagle's eye. With his keen observations, he would pick up and diagnose things with the precision of a detective. I described a conversation of Joseph Bell with one of his patients. Just imagine Joseph Bell sitting in the outpatient department, surrounded by his residents. And this lady walks in and says, "Good morning." Bell says, "How was the crossing from Burnt Island?" She says, "It was good." Bell says, "Where did you leave your other child?" She says, "I left her with my sister at Leeds." And Bell goes on to say, "And did you take a shortcut to the Royal Infirmary?" She said, "Yes, I did." Bell said, "Do you still work in the uranium factory?" She says, "Yes, I do." Bell turns around to his residents and says, "You notice, when she said good morning, I noticed the 5 accent in her speech. The nearest place from Edinburgh is Burnt Island. It is just across a canal. So the nearest place they cross from 5, otherwise you have to go all around. The nearest place is a shortcut by ferry. So she must have come by ferry. The coat that she is holding in her hand is too small for the child that is coming with her. So she must have had another child whom she dropped somewhere. And in her foot, there's red clay. And the red clay is only seen in the botanical gardens. If you've been to Edinburgh, you know the botanical gardens have red clay. And that is the shortcut when you take from the ferry to the infirmary, you have to cross the botanical garden. So there's red clay there. That is how I picked up that. And looking at her hands, she has dermatitis, very typical of the factory workers, the uranium factory workers in 5. So you can very well imagine when Bell would examine this patient, strip her off, how much of information he would get. That is clinical examination, sir. My next picture is of Leopold Augenbrugger, who developed the art of percussion. It is said that Leopold was a son of a winemaker, and his father used to send him downstairs in the attic where they had casks of wine, and he used to knock on the wine casks to see how much of wine was there in each cask. And that is how he developed and started percussion. We still follow that, don't we?
Yeah, we do.
His book, Inventum Novum, had gone into oblivion. But for a physician named Jean Corvisart of France, he was Napoleon's physician, and he dug this out for the world to follow. Corvisart's student was Laennec. Incidentally or accidentally, Laennec discovered what we call the stethoscope. He saw young boys playing with sticks and hitting on a long rod, which we also played. I have played at least, on a pipe. On one side you hit, and the other person listens the other end. That was the beginning of auscultation. Thus, the stethoscope and auscultation found its way in the medical armamentarium, and a beautiful way to examine the body was discovered. Auscultation, along with percussion, found its way, bringing about a sea change in clinical diagnosis in that era, which continues till date. It is said that primary diagnosis of a disease can be predicted only from the history in 74% of times, And the prediction could go up as high as 90 to 95% when you add the clinical examination findings to the history. Pyloric stenosis is essentially a clinical diagnosis. A pyloric mass in the 70s and 80s, senior people sitting here, in the 70s and 80s would be detected by statistics, 87% of the people at that time. In the 90s, you'd be surprised to know that it was only 47% of the times that a medical student or a clinician would pick up a pyloric stenosis. In the 90s, so you can well imagine what it is going to be today in the 2024. I am certainly not against use of technology, it is here to stay for good. But are we teaching our next generation to stop clinical reasoning? A structured online survey of 2,684 practicing clinicians from multiple countries were done. And it is either our fault as teachers, we don't know. 66% of trainees said that they had never observed their consultants examining. They would ask them. And 33% of consultants never demonstrated any physical examination to their students. That's unfortunate, isn't it?
Yeah.
This is about the clinical part. But is it only about diagnosis? What else are we losing when we're not doing a clinical examination? We are losing that tradition. We're losing that celebration of that very important thing called the doctor-patient relationship. We are losing the essential features, the essential forms which form the backbone of our relationships. The power of the human hand to comfort, to support, to empathize. Let me draw your attention to one of my favorite paintings by Luke Fields. Tate of Tate Gallery fame had asked Luke Fields to draw a painting depicting his times. Fields was asked to make a painting showing those times in the 1800s, late 1800s. Fields had lost his son recently. His 9-year-old son he had lost recently. But his attending doctor was Dr. Murray, who sat beside the patient for 23 days at a stretch. And it was a tribute to him that he drew this painting and depicting the social scene of those days. And is still in the Tate Gallery in London. It shows Dr. Murray, an anxious-looking doctor, sitting on a chair, a small girl lying down on a makeshift bed. Would be early morning because you can see the rays of the sun coming from the side, half-empty bottles of medicine. And we can see the anxious father standing at the background with his hands on his wife's shoulder, and the wife clasping her arms in prayer. If Fields today were to make this painting, it would look something like this. The discussion is taking far away from the patient. The patient has been replaced by the computer screen. Have we lost that communication? Have we lost the empathy? Have we lost the trust? Have we lost the consent in our quest for evidence-based medicine? The real patient wonders, the lonely patient wonders, where is everyone? When are they going to come back? Come by and explain things to me. Who is in charge? There's a huge disjunction. And that is where everyone is. On the computer, in a conference room, in tumor boards. Empathy is a desirable quality as it is an important determinant of patient-doctor relationship. Empathic communication helps in the development of trust and openness between a healthcare provider and patient. more accurate diagnosis, and greater compliance to treatment. The secret of being a good doctor is actually empathy. On the other hand, there are some critics also, some anthropologists or sociologists who focused on the negative feelings of the patient during a physical examination of call about invasiveness, anxiety, discomfort to the patient. But on the contrary, we have had many medical studies which show that that is not true. Patients feel much better after being examined properly. And attitudes, of course, to physical examination differ from the West and the East. Most medical studies override the perspective of sociologists who focus on the negative aspects.
You have videos?
I would like to share another story with you. This lady, who is known to me, was diagnosed with carcinoma gallbladder, and is so common in that part of the country where I come from, the Gangetic Plains of North India. She researched to find out the best center in India for the surgery. She found a place and booked an appointment. But I was surprised to see her back in a couple of weeks' time. And I later inquired, why did she come back? Why did you come back? Coming back for a surgery in a small town. She was reluctant at first to tell me. But then she said it was a beautiful hospital with 5-star facilities, nice big ventilated rooms, valet parking, lovely music playing in the background, team of young boys taking you all around the hospital from place to place. But she said they did not touch me. Me and I would argue that what was the need to examine her? The diagnosis was clear. We had worked out to the smallest 3-dimensional picture of her tumor with the MRs and the MRIs and the angios and whatnot. We had gone up to the smallest molecular biology level of what the tumor was. Why did she? It was not required, we would argue. But to her it mattered. It was enough for her to make her come back. This speaks about the human factor, the attentiveness that she needed, the power of the human hand. Examining is a part that the patient is also a ritual. It's a ritual which we follow. You hold the hand, you hold the pulse, you look at the nails, you turn the hand around, see the pulse, go up to the epitrochlear nodes, put your fingers, put your hands in supraclavicular fossa, that go on to the sclera, the conjunctiva. It's a military drill. The ritual is a military drill, which is a ritual. Rituals are important. Rituals are transformational. Rituals herald important events in our life: birth, death, graduation, marriage. Examining a patient is also a ritual, and it seals the doctor-patient relationship. There have been massive advances in medicine over the last 50 years that have been mind-boggling and soul-stirring, but despite that, unfortunately, death is inevitable. Remember this patient who stirred my soul, and I share this with you. This patient had disseminated carcinoma abdominal, CA. It was metastatic disease. I would come every day to examine him. Every day, the ritual was followed. Look at the pulse, examine the chest, the abdomen. That ritual used to be followed every day. When he saw me on what was probably the last few hours of his life in hospital, his hands moved in slow motion. He was following the same ritual of trying to push his clothes up. For me, to do the ritual, to examine his tummy, to examine his chest. I surely think it must have been as vital for him as it was necessary for me. Neither of us could skip this ritual, forgetting that the ritual had a meaning and a singular message. And the message was that I would be there with him always, by his side, forever till his last breath. Thank you.
the same Indian Bharatiya Samaj.